The other thing in general for treatment facilities is how they treat their patients, or how they what the reputation is for treating patients. So are they treating people with respect and dignity in general? And the other thing that I think people need to be aware of is what the facility's protocol is for removing a patient, because lots of them are not accountable for what happens to a patient when they kick them out of their program. So if for whatever reason they don't like what a patient's doing, and that can be a very, it could be as minimal as not agreeing with whatever recovery program they're offering there, if they remove somebody, they basically will call you a cab, and that's it. Or sometimes just put you outside. And this is, we've talked about the dangers of being in a treatment facility and not having any kind of drugs in your system, and then being removed and all of a sudden having access, and what a huge increase in overdose death rates
totally
occur from that. So, I've seen people where they've been removed and without a concern in the world, as if they just kind of dust off their, it's like, okay, you're gone. That's it. We're not having anything else to do with you. And I think there needs to be measures in place to make sure that at least the family members are aware of what's going on. There should be some kind of protocol in place to make sure that those people are getting back to a stable environment. That is my belief.
Yeah.
So definitely, whether or not the facility is responsible for that and accountable, that's something that should be looked into.
Yeah.
And then amenities. What do you think about the importance of amenities? Is that a big deal? Is it a deal at all?
Well, I think it's a tell. Like it kind of shows. First of all, let's assume are these amenities kept up and kept clean and kept functional? Because if they're not, then that's a whole other story, and a sign of neglect or a lack of care within the program. But this is a place, if it's an inpatient facility, that you're going to be spending all of your time. And those are the things that can keep you sane and can keep you productive, can keep your mind clear and remove some stress of the day, and can be really valuable, but also show that the facility has a holistic approach, or has the quality of care in mind.
Yeah, I recommend that people, when they're investigating a facility, see what they're offering online, and then call and make sure that those facilities are actually available. And if they are available, ask when they're available, because sometimes you'll see a treatment center advertising a bunch of different facilities, and you get there and you're like, oh, you know what? The sauna hasn't been working for 6 months, or the gym's only open 2 hours a day, or, so that can, for people who, for me, like exercise that's part of my mental health routine. If I need to be able to do something, and all the treatment in the world is not going to help if I don't have some kind of physical outlet. So that's important. And then there's other things that I think are worth, some things that I've seen that everybody talks about being helpful, like access to like a team sport. Like lots of people love the volleyball at Bellwood.
Yes.
Everybody talks about that.
Yeah.
Access to nature. Like, what kind of, are you going to a facility where you're, in the middle of nowhere and you've got, you're surrounded by pristine mountains, or are you going into the middle of a city, or, that's, for some people, nature is very important. I think it's important for us all, at least a little bit. And then there's other things that may have significant value depending on the individual, like equine therapy and art therapy, or, access to like any kind of therapy, animal, really, like I think they have in the States, they've got like basically where you get assigned you can get assigned a goat or a dog, or all sorts of interesting programs like
That's
that.
right.
But it's cool. I think that you can form a little bond with an animal like that, and that's helpful. And then we talked about food quality. That is something that I think, I mean, you got to have at least a basic level of nutrition being offered. And then what's the access? Like, is breakfast at 6 to 7 a.m. and then the door's closed? That's something that should be looked at too.
Yeah.
And then we go on to look at program variables. So what we see in the literature tends to be evidence supporting a 90-day stay in a facility, whether you're doing inpatient, outpatient. The total duration that does seem to have some kind of impact is 90 days or more. So that should be kept in mind. I know the majority of the programs offered across Canada tend to be they'll go detox till up to 90 days, and then aftercare of some sort is offered, but the aftercare is really pretty minor. I think depending on the individual, if you're serious about making a change and you're motivated, it's probably in your best interest to find a facility where you can kind of get some tools. And maybe if you feel like you need to be in a different environment for a while, there's nothing wrong with that. But overall, I would recommend, based on the evidence, a 90-day total duration. So whether that's some inpatient, some outpatient, whatever, that should be your minimum kind of time to clear your head.
Yeah. Now for mandated programs right now, mandated inpatient programs, they're not though, are they?
No. None are mandated that long.
No.
So they tend to be like usually around a month. Some of them are a little over a month. There's some 7 weeks and 45 days. But
yeah,
and I think the idea there is that we'll get you over, kind of although for healthcare professionals, most people they don't go in under a detox situation, which is very different.
Yeah.
Because if you need to detox before you even start, then it's got to be 90 days, probably inpatient minimum, I would say. Like I didn't go in addicted to opiates. I was past that already.
Mm-hmm. Mm-hmm.
So, that's something to look into, something to talk to your addiction specialist about. And then aftercare should be investigated. What do they mean by aftercare? Because all of them will advertise it, but is that you're given a contact list of alumni who have graduated the program and expected to reach out to, what is the actual aftercare?
It might just be that. Yeah, you're right.
Mm-hmm. So that's an area where you can see some difference in quality. And then something that we've talked about before that doesn't seem to happen as much as it should is the measuring of treatment outcomes, both while in the program. Like a facility should know how many people are dropping out. That should be a number that's available to the public.
Yes, it should be.
And I don't know if any of them would offer that up. And if they would, I don't know if you'd get the honest answer. I mean, I think in general, it's like a 50% for a 35-day program or something, 50% dropout rate. Mm-hmm. That's just everybody who, that would be just an amalgamation of everybody who's trying to go to a government-funded program. But what would be nice is if they gave you some numbers, like as part of aftercare. I think it would be great if there was like maybe even a quarterly check-in with a patient just for a year.
Yeah.
That would be great. I just see, okay, how many people got out and did well for at least a year, and what did those people do that the other people didn't? That would be a start, right?
Yeah. I was told at the time that I would receive 1 year follow-up, I think with a survey, like, do I agree to be given a survey and talk to someone 1 year post outpatient? Mm-hmm. Didn't hear from them.
Right.
Ooh.
Yeah. So it does make you wonder. I mean, if that effort is being made, then what data is actually being collected, and then what data is on purpose not being collected. It's it all needs an overhaul. The entire industry needs an overhaul in that regard. There's got to be some regulation brought in.
Yeah, and it's a tough one because those numbers can seem discouraging. They can seem like a deterrent. But in any other service, like if you were going in for surgery, you'd expect that the doctor would say there's a 75% success rate of this surgery.
Mm-hmm.
And it's just, again, it's the lack of transparency, of course.
Yeah. I mean, you'd hope to be able to have, even if the information is bad, it's better than not having any information. And because if you don't have a marker to start with, then how can you ever improve? And that's probably one of the bigger problems with the entire industry, right?
Yeah. And having that information might allow for some individuals, maybe not all, but some individuals may be able to say, okay, I really need to rally the troops after I get out of here. I need to have need to have some order, need to have some structure, need to change my housing, need to whatever. Knowing that there's risk there, knowing that there's vulnerability when you finish the program, and that statistically that risk exists.
Yeah. And knowing what factors were involved, like even if there was, say it was a horrific, 25% stayed away from their drug of choice at the 1 year mark. Okay, well, what happened to the rest? Like, tell me why. What did they do wrong? So we can try to avoid that. Any information is good as long as it's genuine.
Yeah, of course.
I think most of the bigger facilities will have some sort of treatments offered for the more commonly associated comorbid conditions, PTSD being a big one. You'll see lots of eating disorders, anything related to that you see show up with addiction. It's good if a program has at least a stream available for those people to get some kind of time with their peers, peers who have a similar background, and also some information regarding how it plays into, if they're having problems with substance use, then there's often a lot of overlay in that, whatever the mental health condition is. So that's good information to have. And if you've got a reputable mental health kind of avenue open in a facility, that's a good thing to see. So we can look for that. Inpatient versus outpatient, I don't know. I mean, I guess if you've got a real environmental situation on your hands, in our situation, our environment was our job. So it was much easier for us to be removed from that environment and therefore lower the risk of having problems. But if your environment is your neighborhood, then it might help to go far, far away. And, I think there's at least, a geographical solution can be a solution if the idea is to clear your head. And sometimes you've got to have at least some period of time where you're giving your brain and nervous system a chance to recover. So if that's what it takes, then maybe inpatient is what you're going to need. Because I guess if you're highly motivated, outpatient could work. But if you're, and maybe if you're being monitored, right? Like if you were doing random urine drug screens and you were motivated to do that. But I don't know. What are your thoughts on that?
Yeah, and which is how it was for me. And I know for the stream I was in, it was healthcare professionals. I think all of us were being monitored in that program, and all of us exhibited a strong family support network and strong, just various reasons for why it could work. And for myself, like my home environment, my neighborhood, the fact that I've got a sibling who lives very, very close to me, those things didn't prevent me from going down the path that I went down. But once I left the environment of work, came out with my story, rallied the support, those things did help me facilitate a more healing environment in my home. And then I think it helped the outpatient work. I mean, in my mind, I just wasn't going to go to inpatient. That was my line in the sand.
Yeah. And
I
the
said
kids,
that.
having kids is a big factor for people who usually are adamant about that, right?
Yeah.
And rightfully so. But I think if you're motivated and you're in an outpatient program where you're being monitored like that, I mean, it's only going to help to have your family there. Like that was, I mean, one of the biggest problems with being on the other side of the country for me was that I was very far removed from all my support people.
Yeah.
So, I mean, it's, positives and negatives, I guess, to that one.
Yeah, for sure.
And we touched on cost. I mean, that's going to be, that's going to be, I think right now there's probably a fairly significant wait list to get in if you're just trying to get in, through public health. I haven't looked in a while, so I don't know what I know most of the bigger facilities have to keep a couple beds open for people who are coming through that way, but I don't know what the wait list is. Probably months.
Yeah. And the other thing I was going to say, Nathan, is that within facilities that have more publicly funded beds, at least so there's one in the Fraser Valley here that comes to mind for me, a men's facility, is that there are a lot of individuals who are awaiting trial or who have been sort of sanctioned to go off to a treatment program through the court system. And so if you are a professional or if you, it creates a very, very mixed bag of individuals and potentially, I mean, some tough facilities, facilities with that where it's a really, really mixed population. I want to say that as sensitively as I can, that like, these are not, I look at the inpatient group that I was in as being such a little bubble of all sort of similarly trained, similarly employed people, with probably similar socioeconomic backgrounds and similar family supports, etc. But some of the public, I think, as you go into places with less funding or more public beds, government funded, it really becomes a diverse group, which could be challenging.
Yeah, certainly good.
How's that?
Just that's a good way of putting it. Yeah, I won't add to that. I think you got it. And then the last thing I wanted to touch on was how a program kind of integrates family support. So some are very good about getting the family involved. They actually offer programs that are designed to support family members. And others are, more, they kind of want to, it feels like they want to cut you off and kind of keep you in and limit your contact with the outside world almost. So I think it's, it depends on how they're supporting those family members, of course, but I think being open to facilitating the integration of family along with the treatment program is a positive thing.
Oh yeah, I couldn't agree more. Like how beneficial or therapeutic is it going to be if you are trying to break all these habits and establish new neural pathways and change your behaviors, and if you have family members who are sort of back where you were a year ago, who haven't learned along with you. One of the most beneficial things I think for me was being able, because it was outpatient, being able to go back and talk to my family and my circle about things that needed to be talked about, things that came up for me, where I was like, hey, what about this? Yeah. Whether it was like stuff from my past or just like dynamics of our relationships that I wanted to talk about, that really was helpful. And it didn't fix everything, But if I was like left to my own devices and isolated, and then coming back into all those relationships with like a list of things that I wanted to change about family dynamics, etc., I can imagine that being a lot harder than being able to do it live or
Yeah.
close to live.
Yeah, you'd want to be able to address those things in real time.
Yeah.
Which, yeah, that's a significant benefit to outpatient that I didn't think of. Because I mean, even if like when you're in inpatient, and even if you have access to like a certain amount of time when you could be on the phone or the computer, it's still not real time. Like it's not something comes into your head and you pick up the phone and be like, hey, what about this thing? I mean, yeah, that would be, what do you make a big list of those things and try to tackle it later? That's going to be a wild situation.
Yeah.
But can you think anything else that we missed there? Other than we're assuming that you're going to go to a medication assisted facility. I don't consider anything that's not medication assisted to be a treatment facility.
Yeah.
That'd be fair to say.
Yeah, that's fair. The other thing I was going to say is that, like, in looking at reviews, like, very, very tough to kind of collate all the reviews that you find online and make sense of them. Doing a Google search and finding reviews there, you tend to find reviews of a certain persuasion, some hostility, some negative reviews. Not entirely, but greatly. But there are other forums, looking on Reddit and looking on other forums online where you can find a bit more thoughtful reviews, thoughtful discussions, some back and forth about people who went and spent time in those facilities. I would check out both those avenues, because it's for some facilities, just looking at what Google says, it can be pretty discouraging.
Yeah, because they'll have cleaning services on there too, right?
That too.
So if you see a facility that's like, red flags would be like boasting a 90% recovery rate, and then you look at the Google reviews and it's all 5 stars in the first 15, or it changed my life.
Yeah,
don't go there.
Yeah.
Yeah, go to Reddit and find out what's actually going on there.
Yeah.
But I think that that's a good summation for now. If we think anything else, we'll relay it along.
I think so too. I guess the last thing I would say is, like, keep your ears out for people who are in meetings, and if you're attending meetings early on, and if you're attending meetings that are semi-local, you can often get little pearls about places and some really strong recommendations and ideas about places that work for some people. And there's people within recovery meetings in the community where you can send them a message and say, hey, I want to be able to talk to you a little bit more about facility X and what you actually thought about it. That might be one of your best routes to go.
Yeah, for sure. I would caution grain of salt there too. Just make sure you talk to more than one person if you can, because you could find 2 people went to the same place at the same time, and one will hate it and the other it saved their life. So
yeah, of course.
Yeah. All right, Corey, I think we'll leave it there. Good to see you back in action.
Thank you. You too.
And we'll talk to everybody later.
Sounds good.
See ya.
See you soon.